A cerebral aneurysm is a dilation off of an artery of the brain, which involves all the layers of the brain, and dilates typically like a balloon and extending from the artery itself. These typically occur at branch points, and it's at these branch points for which they are named. The biggest fear of a cerebral aneurysm, or a brain aneurysm as they're sometimes caused, is that as this little bubble dilates off the artery, it can rupture and cause bleeding. And this can result in a catastrophic hemorrhage, which is referred to as a subarachnoid hemorrhage. The symptoms of a cerebral or brain aneurysm can be variable. Oftentimes they're completely silent until they rupture and cause catastrophic subarachnoid hemorrhage. Sometimes they have headaches that are associated with, sometimes called sentinel headaches. Diagnosing cerebral aneurysms is done so in numerous ways. The most common way in which they are diagnosed is typically incidental. We live in an era of cross-sectional imaging, and imaging that's done for a host of reasons, from headaches and migraines to other types of disease states in which cerebral aneurysms can be identified. Sometimes aneurysms of the brain can be the result of trauma or infection. These are much rarer, but these are often diagnosed in particular situations where someone has suffered an acute trauma or is sick with some sort of infection. Western Neuro is one of the leading cerebrovascular centers in Arizona for all sorts of aneurysms in all sizes and in configurations. This is done in conjunction with comprehensive stroke centers that our teams serve, including the Carondelet Neurological Institute at Carondelet St. Joseph's Hospital.